Hello, guys. Good day. This is Anne of Reinforcement Club, your fellow positive reinforcer. Today, we are going to talk about why criticism is a stepping stone for new nurses on the job. I'm talking about those graduate nurses or those nurses who who just got hired in an institution. Why criticism matters, or even sometimes you have to take some sort of embarrassment. It's a good start. So I'm saying that it's important to not take things personally. So it could not be the end for me here. I might gonna transfer to another institution and then another institution. So it depends on the situation. But I have gone through, you know, a couple of experiences being a newbie nurse in the area, or it could be a new place, new hospital, abroad, even in the local. So initially, this is based on my own experience. So initially, most of the time, I started as a wing person to a senior nurse. And culturally, it's different though. I've been a newbie nurse in the local in the Philippines and even in abroad. I was working with with Indian nurses, even Filipino senior nurses with me, and I am their wing person. I am their assistant because I'm just new, so I have to be taught initially for 1, 2 to 3 weeks in the area. So in that situation, you know, I feel like when you are new to a place, no matter how well experienced you are, even you have 20 years, 40 years of experience, that's too much, 20 years of experience, but when you are new to a place or an area, you got to be agreeable at the start. You got to listen. You have to take critics. Don't take critics personally, because critics help you identify, this the specific skills or specific areas that requires improvement in your part. In other words, it enhances your skills development in an area. Like for example, at the moment I am working in the outpatient department. And if I ever get myself transferred to an ICU department or emergency department, I would definitely go back to zero, like nothing. I've got to be agreeable to, of course, to my colleagues, because they are going to be the bridge for my, so I can absorb loads of knowledge, skills, and learning about the area. And, initially when you get to know people, when they teach you, when you are new in the area, there'll be a lot of questions in your head, and as well as to your mentors in the area, to your senior nurses. And they might give you some critics, or sometimes you could get embarrassed. So, but it's no big deal though. That's part of the journey. Absolutely. We're gonna go through the phase as a newbie wherein you absolutely like don't know anything, as in zero. So use critics, embarrassment, even questions, your personal questions, to get to know the place. And it helps you. It helps you develop your learning in that area. And another thing about uh, criticism when you are a new nurse in the area is that, you know, it helps you build professional relationships with your colleagues. You know, the way your co-workers definitely respects nurses or new nurses who are open for feedbacks. Because when you are open to feedbacks and you immediately take action to, when they try to correct you when you've done some something wrong and you take action to that, they would slowly, definitely trust you in the long run. And you know the way when you work together as a healthcare in the healthcare sector, it's all about teamwork. And your colleagues has to trust you and you have to trust your colleagues. You have to trust each other. And you cannot be trusted if you are a new nurse and you're not listening. Your senior nurses there would find it hard to rely on you. So you have to take out that hindrance of building rapport and trust with your colleagues. As I've mentioned earlier, your senior nurses, people who've been working for years and years in the area, are your bridge to your learning as well as to your journey in the area as a new nurse. Another thing about, criticism, about getting embarrassed sometimes is, and then accept it to yourself and then correct it. Another good thing about that is that it promotes patient safety. Feedbacks, usually when your colleagues give you feedbacks, it actually centers around patient care. And that helps you adjust your practices to the point that, your skills, you're going to learn the skills in the area, which primarily prioritizes patient safety and quality of care in that area. Like, for example, emergency department, ICU, you're going to be starting out. So whatever questions that they're going to ask you or you're going to receive, you're going to ask to them, it's all about patient safety because that's our job. And, when you don't take criticism personally as a newbie in that area, it helps you prepare for your future challenges. When you are a newly hired nurse in the area, the challenges wouldn't be just about patient care. Sometimes you're gonna get challenged with your coworker. Sometimes it's about the interventions you received. Is this applicable? How are you gonna question this? How are you gonna deliver the question to the doctor or the physician? Nicely, respectfully, just ask questions. You're going to encounter different challenges, and taking criticism not personally is just one of it. And when you know how to take it, like, don't take it personally, just take action to it, do something about it, then it's easier for you to make adjustment. Job wise, even to your colleagues' relationship. Stress wise, it wouldn't be stressful if you don't fight back, if you're just keep receiving. When you are new in the area, people would love to help you if you're willing enough to receive the help that they give. And in that way, when you have good relationship with your colleagues, with your teammates, and they're going to help you a lot, and that way, since you're not going to get stressed with them, and that way you can build relationship with the patients, with your work. And there will always be people who's going to guide you. Just be friendly, agreeable, and be a good wing person for them. Since they're your senior nurses are helping you, be a good service to them in return. And along the way, when you have good relationship with your colleagues, and they're going to help you with your skills on the job, and that way you can gain confidence. And every time you get corrected and you do the right thing, according to the protocol. Of course, your colleagues will always teach you the right thing according to the protocol, the policy in the area. Every time you do something good, and that will help you build confidence. It shows that you are adaptable and committed to your work. And at the end of the day, when you are listening, when you're following instructions, that will make you trustworthy person. They can rely on you. They can trust you because you can have open communication to each other. You're not fighting back. So that's how important it is to use critics, even embarrassment. Sometimes you feel like you're zero when you are new in the area, regardless of your experience. When it is something new to you, you absolutely have to go back to zero. And you don't that actually a good start. You don't have to be great to start. You have to start for you to be great in the area. But that's how it is. And when I was new in the area, I've worked in a different department. I actually felt like I was a student. Every time I venture a new area in nursing. So like in the new hospital in the local Philippines, and then when I went to Saudi Arabia, I have to go back to zero again. I get to know the routines, and what really helped me a lot, to be honest, is a good relationship with my colleagues. Because I wouldn't learn anything without their help. And since I have a good relationship with my colleagues, and they're gonna help me a lot, then I have no stress about it. Then I can practice my relationship with the patient and the patients, and then know the routines with the help of my colleague. Everything is it's all about good relationship. And sometimes I got embarrassed, especially when I was exposed in theater. I absolutely never liked theater. It took me almost 3 months to memorize I even forget about the things that is to be used for even C-section. There's only few utensils there. I even forget about how you call that. It took me like almost 3 months because I don't like to be in theater, but because of my colleagues, of my teammates in the area, was like, I love it. I love how they care for the institution, how they were patient for me to learn. They were always there, to the point that I finally accepted to myself that maybe I could be a good help if I finally learn to, what are this for? If I can be a scrub nurse for this operation, because I never liked theater, but I was there. I was able to manage to be a theater nurse because of the undying dedication, help, and patience of my colleagues, and thank you very much for that. I actually missed the teamwork. It was a busy area, and thank you very much from the bottom of my heart. So it's all about teamwork and good relationship overall. Criticism, embarrassment, it happens. Not only in the job, but it's a good start. It's part of the process. So I'm saying this time, look, criticism it's all about how you take it. And don't take it personally. So we'll be able to live in peace, all of us. So yeah, criticism is a good start, is a stepping stone towards a good relationship in the workplace. So take action, but don't take it personally. I hope that you learned something from the episode today. If you ever love this content, you can share this to your family and friends. You can follow me in YouTube, Facebook, Spotify, Apple Podcasts, even in Amazon Music. Reinforce Big Love. By the way, this is Ann, your fellow positive reinforcer. I do appreciate your time and have a lovely day ahead. Thank you and almost Happy New Year. Thank you very much.